We're going to go ahead and get started now. My name is Drew Harden. I'm the VP of Sales for Vios Medical. We appreciate your time and thank you for the opportunity to meet with you today. This presentation will be approximately 45 minutes, and we'll leave 10 minutes or so at the end for Q&A. Just a couple of housekeeping notes before we begin. All attendees are muted, but questions are encouraged. It can be submitted via the Q&A button at the bottom of the screen. This webinar will be recorded, and a copy will be sent out to all attendees within the next 24 hours. And please let us know in the Q&A if you're having a technical challenge. We'll work to address that immediately. As mentioned, my name is Drew Harden. I'm the VP of Sales for Vios Medical. And joining me today is Amit Patel, the co-founder and CEO of Vios Medical. During this presentation, we're going to introduce you to Vios. We'll share an overview of demo of the technology. We'll discuss some real-world scenarios and use cases. And finally, we'll answer any questions from the attendees. Before we get started, I wanted to walk you through, next slide. Next slide, please.
Yep,
Thank
so
you.
no, it should be on. There you go.
Yep, there you go. Before we get started, I just wanted to walk you through a scenario that likely resonates with many of you. This is Connie. Connie is an RN working evening shift at a skilled nursing facility. She just received a 77-year-old male from the hospital for continued recovery and rehabilitation. His presentation, he's recovering from pneumonia. He has a confirmed cardiac history, and of course, multiple underlying comorbidities. Upon presentation, his baseline vitals were sinus tach with 110 heart rate, tachypnic with 32 to 34 breaths per minute. And obviously, the entire team is concerned that this patient may deteriorate overnight. Connie, of course, she has a full patient assignment of 18 patients or 18 residents to herself. They're short-staffed. And of course, there's some concern that the patient will deteriorate overnight. Currently, the only option is to rely on the overnight spot check vital signs, which could lead to clinical deterioration that may be overlooked. She already has several acute patients on her assignment, and without timely oversight and preventative action, this patient could deteriorate and ultimately need to be transferred back to the hospital. Does this sound familiar? I'm sure it does. This is just one particular scenario that we hear from our partner healthcare facilities each and every day. And we look forward to sharing some solutions and to go through some of these common challenges. And for that, I'll hand it over to Amit to share some additional details.
Thanks very much, Drew. Thanks everyone for joining and welcome. Again, I'm Amit Patel. I'm the CEO and co-founder of Vios Medical. And before we get started today, really wanted to set the table for what you can expect to take away by joining the webinar. Appreciate giving us a little bit of your time. And what we're ultimately going to do is walk through, and provide a deeper understanding of how technology can help address some of the more common post-acute care delivery challenges. I know you're facing a higher acuity mix, staffing shortages, and ultimately, leading to increased readmissions. We'll also provide some practical considerations in deploying technology like vital signs monitoring and remote monitoring services. It's not just a implementation consideration. There's a lot of things leading up to it and after the fact, and you need a river guide and a partner that can help work through those points. And finally, we'll give you an overview of if done successfully, the steps you ultimately can realize some meaningful clinical, operational, and financial benefits when adopting technology, and that's we'll provide a deeper overview of that as well. So Vios Medical was founded in 2012 and acquired by Murata Manufacturing in 2017. We're the original pioneers of wireless vital signs monitoring and remote monitoring services. So we're not just a startup. We've got a lot of resources behind us and are committed for the last decade and for upcoming decades to come in really helping to try and solve key challenges facing healthcare delivery. We have 75 employees worldwide and are headquartered here in St. Paul, Minnesota. And the vision for the organization is to really enable an easy monitoring solution that can safely move patients down the care continuum, reduce clinician burden, and ultimately lower costs. So as we set the table for why we exist, I hope that gives you a sense of where we're coming from and who we are. So these are statistics that are likely not going to be very surprising, but there are major shifts in U.S. post-acute care that are occurring and have been occurring for quite some time. Over the next decade, there's anticipating acuity mix increase for post-acute care, where there's just higher acuity patients that are more complex, require more care, that will be coming into the system. With that comes a challenge around staffing, and 61% of facilities are reporting that because of that increased acuity mix there and the staffing challenges, they're having to turn away patients. And that's obviously a challenging place to be as well. And what's also been done is some analysis on of the readmissions that occur, what can be done to avoid them, and up to 78% of those readmissions can be avoidable if the appropriate steps are taken taken into account and adopted. And so, really here to kind of show some of the ways that we can use technology to avoid those readmissions. But what can be overwhelming is understanding how technology is changing, and there are a lot of different options that you can use. If you look at vital signs monitoring being historically a foundational tool, that's obviously evolved to become cheaper, better, faster. Remote oversight of that data has also become more prevalent with remote patient monitoring and other approaches in that regard. The electronic medical record, obviously serves as a point of consolidation for all the information that's being generated to create actionable data. And then on the horizon going forward is artificial intelligence, which obviously is, I think everyone's heard about and is wanting to get involved with, but obviously is a very daunting task going forward. At the end of the day, whatever technology is chosen, it needs to be easy to use, affordable, and ultimately sustainable. And by that, I mean that the clinical team is willing and able to use it in a everyday manner. It has to meet their needs and really serve a purpose a day in, day out in order for technology to be successful. And when technology is used properly, you can see some pretty meaningful benefits. We have had multiple customers realize tremendous benefits. And one of the most stark statistics is we've had a customer reduce their readmissions up to 40% over the first 6 months after adopting our technology, which is a really meaningful reduction. We've also seen an increase in patient length of stay by, of course, reducing the number of readmissions. The patients are remaining in the facility for longer. So that's been a pretty meaningful jump. We've also seen improved partnership with their referral sites. So obviously, if you're using technology to take better care of your patients and they're not going back to acute care, you're able to develop that reputation and improve that partnership dynamic with referral sites. And ultimately, the benefit of all this is by having virtual oversight, we're able to not only keep patients safer, but also augment that on-site care team that really is stretched and looking for any type of support that they can get. And that's really what our 24/7, 365 remote monitoring service really lends a hand, is in providing that support. So next, we'll go into a little bit of a deeper dive on our solution, the Vios monitoring system, and provide you not only a walk through the technology and an overview of vital signs monitoring, but Drew will later provide an in-depth demo of the technology itself, so you can kind of get a firsthand sense of how the technology operates. So before jumping into it, you really kind of want to address a few things, and the most important being that continuous vital signs monitoring really is the foundation for lowering readmissions in those more complex patients. So continuous vital signs monitoring is essentially a continuous capture of the vital signs information. Typically, in a lot of the facilities that we come across, the standard of care may be just spot checks at a periodic basis. So it could be as little as 1 hour up to 12 hours. And so in between, there really are information gaps that could be generated. So continuous vital signs monitoring allows for that continuous capture of information so that you can better sense when patient deterioration could be occurring, which can sometimes just take a few minutes. And so by having continuous vital signs monitoring, you're able to capture those changes and trends that occur and really look at that information to better inform how to take care of your patients. But as I mentioned, with continuous data comes the need to oversee that information. So timely oversight and action based on the data is really a critical aspect of having continuous vital signs monitoring, and is really a necessary component in using vital signs monitoring to better manage patients. We also need to ensure that you're matching the right monitoring technology to the right types of patients. Obviously spot checks are absolutely appropriate for lower acuity patients that don't maybe necessarily have a high risk of decompensating, but a lot of times that's not appropriate. And so, really understanding what technology should be used for which patient sets is part of this equation as well. And as I was mentioning earlier, in order to navigate all these points, we are very proud of the fact that we partner with our sites to create a successful and sustainable process. I think our nursing teams, our IT teams, administration teams, one of the best things that we can represent about ourselves is we create a very involved experience for them and are very responsive to everyone's needs, and that really is important to ensure a successful and sustainable partnership over the long term. So the Vios monitoring system really is a comprehensive, integrated solution that addresses all of the key needs within one package. And it's really, if you break it down to a couple components, one is the wireless chest sensor. It's a body-worn wireless device that's very elegant and easy for patients to use and wear. It's very comfortable. There's no wires, so there's no need to have interventions whenever the patient's ambulating and so on and so forth. And this wireless sensor is able to continuously capture 7-lead ECG, heart rate, respiratory rate, SpO2, patient posture, and patient activity. And I think some of the posture activity items are really nice for things like managing pressure injuries and things of that nature, which Drew will go into a little bit later in the demo. Next is the bedside monitor and central station monitor. These are software applications running on a tablet and a desktop computer, respectively. And that really allows the data from the sensor to be transmitted and viewed, and all the alarming and all the in-depth analytical capabilities reside in these two software packages. And then finally, we offer a 24/7, 365 remote monitoring service that oversees that information to really ensure that if something is occurring, we're catching it and that we're dispositioning it. And one of the key elements of it as well is that instead of having to have all that continuous data dispositioning done at the bedside or at the central station monitor, we're able to initially disposition and filter out any false alarms that occur. So, one element that we also can address with this is alarm fatigue. And so by having actionable data that we're looking at ensures that the nursing teams on site are able to really take care of their patients and let the oversight of that information be handled by us. But in order for technology to be successful in ultimately lowering emissions and realizing some of the other benefits, it really requires a systematic process through which you adopt technology. And we've been doing this for quite some time, where we've really broken it down into 3 steps that we feel are critical in order for us to be able to help our partners realize the benefits that we've kind of been touting. So first in that process is assessing in determining if a site is the right is a good fit, and determine the appropriate number of Vios beds. We're not here to try and push as many beds as possible. Quite frankly, we want to ensure the right facility with the right acuity mix gets the right technology. So that assessment is critical. We then implement the technology and provide training and support for the care team, and also provide custom marketing campaigns for your referral sites. So part of this is making sure you can share with all of your system partners that you're adopting technology, you're leading the way in using technology to get better care of patients, and that you can be trusted to take care of patients that are provided to you, and ultimately preventing those readmissions from occurring in the first place. And then finally, we help evaluate whether or not this has been a successful implementation. We do a 90-day look back and ensure that everything's working well. And if it's not working well, we'll make adjustments, and ultimately also provide a risk-free cancellation. So if it doesn't work, we're able to take the technology back and are in no worse off spot than prior to the implementation, which hasn't happened yet, but we offer it just as an opportunity to give comfort in case that is something that's a daunting implementation task. So a little bit more about each of these. On the assessment side, we really want to ensure that you have the right acuity mix. A lot of facilities have a lot of different kinds of patients, so we want to ensure that the right kinds of patients are there in order to ensure that we give the right type of monitoring technology, as I mentioned earlier in the webinar. We want to ensure there's a receptive team, not just the clinician side, but also the administration, the IT teams. We want to ensure that they're willing and able to adopt technology, and that there's a clear champion. We obviously can't do this without on-site help, and so that champion really helps to ensure that can navigate some of those day-to-day elements that are critical for long-term success. We also determine if there's the appropriate number of Vios beds. Like I mentioned earlier, we don't want to try and push too many or too few. Just the right amount will really help drive the most impactful implementation. We do an IT and Wi-Fi assessment to ensure that the technology can operate properly. It's a very light implementation, but that still requires an IT and Wi-Fi assessment. It's secure, it's stable, and that there's no surprises that we see in that regard. And then we'll also provide an anticipated return on investment to ensure that you appreciate fully what are the benefits that you're going to glean as a result of using the technology. Next, we implement the technology. So we come and install the Vios monitoring system. Drew, other members of the team are there physically on site to help with that process, ensure it's successfully implemented. We have also evaluate and implement the remote monitoring service escalation pathways. So part of this is working with the clinical team and say, hey, what are the types of alarms that we want to alarm for? What are the conditions that we should give you a call, not give you a call? Who are the stakeholders to ultimately up-escalate that to? Those are some of the details that we would want to ensure are captured and aligned upon during implementation. And then we provide at-the-elbow training and support. I think it's really important to have hands-on experience with the technology, both prior to and during the go-live process. And if there's anything that occurs thereafter, we have a 24/7, 365 support model, which really is there for you in all ways, shapes, and forms that's necessary to ensure a successful long-term implementation. And then finally, we also evaluate after implementation. So we look at the 90-day benefits and ensure, hey, are we meeting the goals that we had set out? Are we seeing the benefits that we had anticipated to do? If not, what are the adjustments we need to make? We can provide additional training and support as needed. Maybe there's a gap in a certain clinical team, or a particular feature needs to be further elaborated upon. So we can go ahead and dive deeper into that. We can also adjust the total number of beds. So let's say there are too few beds, we can add more, and it's a very elegant model that allows us to very flexibly go up and down if required. So that's something we can make an adjustment for. We can modify the remote monitoring services escalation pathways to ensure that we are making the right calls at the right time, but maybe there's too many calls or there's a few things that need to be adjusted. We can make those modifications. And ultimately, if all said and done, it's not working out for whatever reason, there's a risk-free ability to cancel at any time. And I think, again, like I mentioned earlier, it's not been something we've seen, but we provide it as an insurance policy because this is obviously a major initiative, and we want to ensure that you're comfortable that it doesn't work out for whatever reason, that there's not a long-term commitment that's there as well. So I think the reason I broke this down and thought it was important is because it's not just the technology, it's really coming in, assessing, implementing, and evaluating technology in order to have it be a long-term successful outcome. And so I think this is really helpful, hopefully, to explain the details behind each of these, to say it's not an overwhelming process. There's actually a step-by-step method, and we have your back and can cancel at any time if that ends up not panning out. So next, what I'll do is I'll hand over to Drew. What he'll provide is a detailed overview of our technology. So the bedside monitor is at the patient bedside, excuse me. And so then a walkthrough of that. We'll have a live central station monitor demo, so you get a sense of what am I actually going to see, and how do I actually use that information to better take care of my patients. And then we'll also give a sense of the remote monitoring service workflows, so you get a sense of how does that 24/7 RMS partner work in providing that support virtually. So Drew, over to you.
Thank you, Helmut. As mentioned, the bedside monitor, this is the tablet that's placed at the point of care. And the benefit of the tablet is it allows all the members of the care team, whether it be the physicians, the nursing team, pulmonary respiratory, and actually one of the most valuable members of the care team are the rehabilitation team, the therapists that actually visit these patients. They can take the patient's tablet to the gym so they could see the patient while under exertion. They could see them while they're ambulating. So it just gives them a real-time viewing capability of the patient's vitals. While entering the room, you can see here, and I'll show you on the central station, but there is the patient posture and this timer. So that will help the team manage the turns and to try to help prevent pressure injuries. And in the unlikely event of a IT or technical downtime, the tablet will serve as the patient's monitor. So you simply would enter the room, just like an iPad or any other tablet. You just increase the volume until the IT infrastructure is restored, at which time you can then mute it. So now I'm going to go ahead and just move to share the central station. So I'm going to share my screen. Okay, so this is the central station monitor. This is our tile view. It allows you to view up to 12 patients.
Your screen isn't quite up yet, so maybe get
okay.
Sure.
Let me know when it's up. Is it active now, Amit?
Yep, gotcha.
Thank you. So this is the tile view. So you can view up to 12 patients at one time. By a quick glance, you can see if a patient is in an alarm condition, as you can see as Tony Soprano is down here with a high heart rate of 179. You can also see here that this patient has a pacemaker denoted by the icon and the correlating pacemaker spikes. By simply clicking on the patient, you enter what's called patient detail view. So in this particular patient, you're seeing real-time waveform data. You have really three icons that you can interact with. The first is the review mode. This allows you to see all the historic data. Let's kind of disconnect this for this patient. So by simply clicking on any of these alarms, you would see strip. And we have a new feature that we just released called full disclosure. And this just allows you to go back and look at large amounts of ECG data. So our monitor technicians, your on-site care team can do this as well. So you simply would click into any particular part of the ECG strip. And on the right-hand side, you will see the corresponding 7 leads of EKG. This is very helpful when you're looking for onset and offset events. And the monitor technicians can capture these for you and generate the reports. And lastly, you have a trends button. The first thing you'll see is a graphical trend. You can go back in time. So let's just say if a clinician is coming on service and they want to take a look at how the patient was doing in the last 8 hours, they can see graphically heart rate, SpO2, respiratory rate trends. You'd also see min, max, and averages for that time frame over here on the right. And by just clicking the table button, this is more of your traditional tabular trends, which can also be filtered by 5, 15, or 30-minute intervals. If we are interfaced with the electronic health record, all these continuously monitored vital signs would be automatically exported to the EMR for review by the clinicians. And the last thing I'll show you is the report data. So as mentioned, our monitor technicians will be doing reports for you on a daily basis. So this is just an example of an ECG report. It would have the monitor technician's interpretation, some of the caliper measurements, and this would be waiting for the team. We do 2 strips a day, and on any change of condition, this could be reviewed, printed locally, or it can be uploaded into the electronic medical record. Stop sharing. So next thing we want to just kind of briefly review is the remote monitoring service workflow. So we first ask just the clinicians to apply the sensor to the patient, get it paired to the tablet, and activate remote monitoring service protocols. As mentioned earlier, the remote monitoring service, the technicians will disposition the clinical and technical alarms, will keep all that work and that alarm fatigue off of the frontline care team. We want them focused on doing their patient-centric activities, and they will not be listening to alarms or having to sit there and view the monitors. The technicians will follow a predetermined escalation protocol and notify the on-site care team if anything does change with their patient. They would then just follow their typical response mechanisms to get to the bedside and coordinate care. And as mentioned, our RMS technicians will be doing all the documentation and creating those reports for review and uploading to the EMR. So hopefully it gives you just a high-level idea of some of the technology and the workflows that we follow to support the bedside care team. I'll turn it back to Amit, and he can walk you through some of the additional clinical, operational, and technical benefits of implementing Vios.
Thanks very much, Drew. So hope everyone got a deeper sense of the technology in action, which is obviously great to see. I think at the end of the day, why do it? And as I mentioned earlier, we see a pretty tremendous impact on the readmission side. A 40% reduction is a pretty meaningful impact, and over a 6-month time period, we're able to achieve that. And I think one prevented readmission can pay for an entire year of implementation. So this is obviously a pretty meaningful number, but also gives you a sense of it's not a terribly cumbersome economic value proposition also to try and adopt something along these lines. So in addition to the reduction of acute return to acute care episodes and the associated penalties, our partner sites have also seen a reduction in revenue loss by virtue of not losing those patients back to that return that hospital setting. You're able to see a greater number of referrals from partner sites due to enhanced reputation and trust. Again, I mentioned earlier, we have that custom marketing campaign that we're able to co-create materials to share with referral sites. You're able to ultimately create safer patients, which is the name of the game here is obviously maximizing patient safety and able to manage higher acuity patients safely as well. And at the end of the day, the satisfaction that we create not only for the patients and their families is improved, but the nursing teams also have significantly greater satisfaction, and they're able to practice at the highest extent of their license and ensure that they're maintaining patient safety and ensuring that they're able to oversee those patients while also taking away some of the workflow burden associated with that is obviously a win-win value proposition for the clinical teams. So if you recall, Drew at the beginning had outlined a hypothetical situation with Connie. Actually, this is a real sequence that occurred with one of our early partner sites. And so what ultimately ended up occurring is that patient converted to SVT and ultimately into new onset atrial fibrillation with rapid ventricular response. And what the Vios system was able to do is we first alarmed for the high heart rate. The RMS technician verified that alarm was accurate and then gave the on-site nurse a call. And ultimately that led to in this case, Connie, contacting the on-call cardiology team. Medications were ordered to treat the cardiac condition, and that patient's heart rate ultimately reduced to a stable range. They remained in the facility and ultimately avoided a transfer back to the emergency room. So, I think we have countless examples of these types of stories, both on our website, and we'll provide a link to that here momentarily. But these are the kinds of real world scenarios that we're able to create and have successful outcomes around, and hopefully give you a sense of where and how the implementation of technology is able to address some of those challenging inflection points that clinicians face on a daily basis. So in summary, to kind of tie back to the key takeaways today, technology can in fact help address post-acute care delivery challenges, by overseeing higher acuity patients with a more, robust oversight model. It also augments staff's capability to manage a higher caseload and complexity load, and ultimately reduce readmissions by taking action when there are subtle changes that occur, during those moments. We also have a 3-step process that allows facilities to effectively deploy technology, and we do it in a structured, systematic manner, and also we provide it on a risk-free basis to ensure that if there is something that doesn't work out, that there's not a long-term, a commitment that's there as well. And ultimately, facilities can realize tangible clinical, operational, and financial benefits of adopting technologies. And as I hopefully was able to share, there are lots of different ways in which that ROI can be realized, obviously from a hard cost standpoint, but also from a reputation, referral standpoint, and ultimately staff and patient satisfaction as well. So lots of different ways in which those benefits are realized. So as I mentioned, we've got a QR code here to our website where we have a variety of additional resources. The clinical brochure where we went through that scenario with Connie is available along with other case studies. So you get a sense of the types of ways in which we've been able to create some real interventions with our partner sites. We also have an ROI calculator where you can input your facility's information and outputs a customized sense of what are the ways in which that value is ultimately created. So that's a really nice way to kind of see for yourself and for your facility what could be the benefits. And ultimately, Drew and team are here to answer any questions. We can do a more in-depth demo or just have a conversation about any of the items that we went over today or any questions you may have by scheduling a demo and a conversation with one of the members of our team. So that QR code again here, in case you wanted to take a quick scan and jump over to the website. Otherwise, www.viosmedical.com is another way that you could obviously access that. At the end of the day, we want to thank you for your time today. We know it's difficult to carve out time in very busy days to be able to kind of walk through some of these points. So definitely appreciate that. We've got a variety of social media platforms that we're on, so please feel free to follow us on any of those platforms. And we're also attending a variety of shows here in the coming year. So if any of these you're planning to attend, please look us up. Feel free to reach out to us in advance or just come stop by the booth and have a conversation with us. We'd love to talk to you and learn more about you and your needs and how we could potentially be a partner with you going forward. So end of the day, I want to thank you for your time. And at this point, we'll open it up for questions that we may have. So Drew, I don't know if you had any questions that came in that we can answer.
We did. Thank you, Amit. So the first question states, it would be great to understand the cost savings effectiveness vis-a-vis the cost to utilize the Vios system. So I think it's a great question. So recognizing that capital and cash flow is very challenging for post-acute healthcare facilities, we have several ways we can structure. And typically we lead with a subscription model, which is a low fixed monthly payment per Vios bed, inclusive of the hardware, the software, and the 24/7, 365 remote monitoring service. Of course, it has an obsolescence protection, so we're going to support the product for the duration of the contract. Essentially, one of our COOs from recent implementation said, if we can save 1 day of a readmission, it pays for the service for the entire month. Amit kind of covered some of them. Really what we're trying to do is decrease the return to acute care incidence rate, protect your revenue streams, help you attract the right types of patients to your facility, and ultimately trying to provide better patient outcomes for both the facility and, of course, the patient and their family. One of the questions we received is what patients are qualified for Vios, which we also get a lot. It's a great question. Here at Vios, we're not prescriptive on what patients can and should be monitored. Really, it's up to the facility, but we work with them to kind of create a policy and procedure. So many of our healthcare facilities, what they'll do is when they're receiving a new admit from the hospital, they want to establish their own baseline. So typically they know the patient's past cardiac history, as mentioned with Connie's scenario. They may place the patient on Vios, monitor them for 24 to 48 hours, establish that baseline. If they're stable, they can discontinue monitoring, clean the device, and use it for the next patient. But patients that will benefit the most from our technology would be, of course, cardiac patients, folks with pulmonary and respiratory, and obviously at the discretion of the clinicians and the medical team. It's not uncommon for a patient that is during their rehabilitation stay, if just the clinicians don't like the look of the patient or the patient's presentation, they can within 5 minutes, they can have this patient up on monitoring. They could determine what the patient's condition is. Are there any underlying changes? And then make the best decision whether to treat the patient safely in place or if they need to transfer the patient back to the hospital. We're not making claims that every patient is obviously going to stay in the healthcare facility. There are limitations to what can be done. However, a timely transfer will often lead to a better patient outcome. And then last, we just had a question about the battery length. So the device itself, we provide 2 chest sensors for every monitored bed. So 1 chest sensor would be on the patient and 1 would always be in the charger. The device lasts for about 40 hours on a full charge. So it's not something that the clinicians will have to run around and be swapping every shift or every day. Our monitor technicians will notify the clinicians that the battery needs to be changed. They usually have 4 to 6 hours to get to the bedside to do that. Once they can swap the sensor out, it takes less than a minute. They simply clean the sensor that's coming off the patient, place the new sensor into the patient's adapter, and then resume monitoring. Amit, that's all the questions that we received for today.
Okay. Well, if any other questions, let us know. Obviously, we can reach out to us directly. You've got our contact information here. If no other questions immediately, we can bring this webinar to a close. So thank you all for attending. If anything else that we can do for you, please feel free to reach out. Otherwise, have a great rest of your day, and best of luck as you navigate your care environments, and hopefully we can be of help in doing so going forward. So thank you.